Welcome to this week's episode of What Would You Do? Our first contestant is ER Tech Andrew Concha.
A man approaches our facility to register his wife to be seen. As he walks towards the registration desk, you notice that he's carrying a firearm on his belt. What would you do? Patients or anyone in possession of a dangerous weapon, such as firearms, must be asked to remove the weapon from the facility and safely store it in their vehicle. If the patient is unable to make arrangements to remove the weapon, contact law enforcement to secure it. Please note that the hospital facilities are not equipped to store firearms, and our staff are not trained to handle, unload, or care for any weapons.
Up next is inpatient nurse Rebecca Slice.
A newly hired employee asks what this symbol means. What would you do? This symbol means that the item should not be reused. A single-use device is used on an individual patient during a single procedure and then it's discarded. It is not intended to be reprocessed and used again, even on the same patient, to ensure patient safety and reduce the risk of contamination or infection.
Our last contestant is ED nurse Derek Hendricks.
A newly hired employee asks why there's a stop sign on the hand sanitizer station located near the ER entrance. What would you do? We want to ensure that our staff, patients, and visitors have clean hands when they enter our ED exam rooms and inpatient rooms. To achieve this, we follow the stop and sanitize process. Every facility has a hand sanitizing station right at the entrance to the ER. We ask all our staff when bringing in a patient to stop and sanitize in front of the patient if possible. Politely ask the patient if they would like to sanitize their hands. If the answer is no, then continue escorting the patient to their ER room.
Thanks for watching, and we'll see you next time on What Would You Do?